Well, the Western Cape says it's excited that those over 18 are rushing to get their jabs. We can talk to the Western Cape Health's Chief of Operations, Saadiq Kariem. Saadiq, thanks for your time. We appreciate it. First, let's start off with how many people you saw turn up yesterday for the jab.
You're quite right, Shahan. We're extremely excited. This is a very exciting group. We saw yesterday we vaccinated 20,000 of those in the 18 to 34-year-old age group, and all our sites had long queues of this cohort. And thus far, we've registered 178,000 people in the 18 to 34-year-old age group.
How's it looking today?
We had some sites that were active. We had about 25 sites around the province, and so obviously we'll tally up the numbers. But again, I saw photos of long queues of the 18 to 34-year-old, and I call them the AMA TikToks because they're obviously posting quite a bit on social media.
Yeah, and you would also know that the AMA TikToks don't want to be waiting in long lines. So what are you doing to deal with that?
No, absolutely. Look, we obviously have to prioritize, and I think from all the people we've spoken to yesterday in these long queues, they understand that we have to prioritize those that are 60 years and older, and those that are 50 to 59. But they're actually patiently waiting. They know that they're going to be vaccinated, so we tend to communicate with them in the line as we vaccinate people, so that they at least understand that there is a bit of a wait, but that we are and we will get to them.
So talk to me about possibly easing up the pressure here on your current sites. Are you considering more vaccination sites in future?
Sure. So at the moment, we have in the public sector, we have about 197 active sites in the public sector, and we have about 133 active private sites. And we bring sites online pretty much as the need is required. As you know, we've opened up the Athlone mass vaccination site recently, and in the next week we'll be opening up another mass site in combination and conjunction with UCT, the University of Cape Town, in the Mowbray area, and the age group and the focus primarily will also be the younger group, the 18 to 34-year-old age group.
Yeah, and then, of course, we heard from the MEC in the Western Cape for Health about possibly even going to bars and nightclubs to get people vaccinated. Is that really going to happen? Yes,
she's asked us to look at that. Obviously, what the MEC would want is for us to focus on places where young people gather, such as bars and nightclubs. So we will consider that. There's quite a lot of logistics obviously involved with that. But we have successfully been vaccinating the homeless, as you well know, and we've been successfully vaccinating people at our pop-up sites. And so we can certainly consider that going forward.
So how is that going to work, though? Let's be realistic, right? Because when you get the jab, you're not supposed to drink. And if you're at a bar, well, naturally, that's what you're going to do.
Yes, that's what I say. We'll have to consider that. I must say we haven't yet worked out the operational logistics of how that would happen, but it's certainly something we can look at and take that one forward if it's possible to do that.
In terms of making it easier for this younger generation to get vaccinated, is there any way that can happen, or do we have to stick to what's unfolding right now?
So obviously, I mean, I think at the moment, what I think would certainly help is to have more vaccination sites that are opened up in the communities, because one of the issues that we found is that there's still quite a bit of inequity in terms of where people get vaccinated. So we try not to let people travel too far to vaccination sites, and particularly the younger people would want to try to make it as convenient as possible for this group. We're also opening up a drive-through vaccination site at the Athlone Stadium, and I think that this will appeal actually quite a lot better to the younger group. If that works very well, we can obviously consider how we will expand those lanes. We're opening up with 2 lanes, but we have the ability to expand it to 5 lanes. And from what the Premier and MEC have done in terms of their walkabouts and talking to the younger group, we think that that will appeal to this younger group.
Let's not forget about rural areas, right? How do you actually get the vaccine out there for younger and older people?
Sure. So we've got a very tight and a very clear logistical supply chain in place. So we are able to move the vaccines quite quickly, both Johnson & Johnson as well as the Pfizer vaccine, from the central store that we have, and we're able to move those vaccines quite quickly to the rural areas. Of the 133 vaccines, for example, there are 133 private vaccination sites. 47 of those are in the rural areas. So we've been doing this for many years. Remember, we've been vaccinating, in the rural areas and the metropole for many years. So we've got a very clear, a very tight logistical supply chain that takes the vaccines out.
In terms of the over 35s, how are those numbers looking? Because we saw a decline last week and the week before. Are there any improvements there at all?
Yes, that has been a concern. The numbers in the over 35s have been dwindling at our vaccination sites. And that's been part of the reason why we've been able and supporting the registration and vaccinations opening up for the 18 to 34-year-old age groups. So we're trying to increase that, the vaccination and registration of those groups by talking to trusted community voices, by working with community organizations, by working with community leaders, religious leaders, particularly in the communities, to try and get people to the vaccination sites. And we're encouraging people to come, even if they've not registered, they can walk in, we will register them on site. So we're trying to put out quite a lot of different strategies to try and bring particularly the 35-year-olds and even within that, particularly the 60-year-old age group, because they are more vulnerable.
Yeah. All right. Thank you so much for your time. We appreciate it, and good luck with that process. Western Cape Health's Chief of Operations, Saadiq Kariem.